for inviting me. It's a great pleasure to join you. Firstly, congratulations for your foresight. In addition to the points that Professor Sartorius has already mentioned, I think one of the major factors that you youngsters need to bear in mind is the role that you can play as advocates for your patients and their families and their carers, but also as members of the society, you have sort of role to influence policymakers. And the second thing that an organization like this can do is learning from each other. No matter how much we scream and shout, there will never be enough resources. Um, so what we can learn, and during my visit to various countries, I've seen some wonderful examples of good clinical practice, which is being done in a very innovative way by engaging community leaders, volunteers, religious leaders, a number of incentives and initiatives which have appeared around the world. And I think, if nothing else, this organization such as this can A, make you feel less lonely and alone, and B, teach each other as to what to do. And I think I would, before I kind of go into burnout, I would like to pay tribute to Professor Julian Leff, who rather sadly passed away last Tuesday. Some of you would know him personally. Others would have heard his contribution to the field of social and cultural psychiatry over the last nearly 50 years. So just to pay tribute to the work that he has done, he was one of my mentors, and I'm really grateful to him for his support and his vision. So moving on to burnout, I think since I have only about 10 minutes to go, of which I've already used 2, the challenges of burnout are manifold. I mean, firstly, when we look at definition of burnout, it's about physical, emotional, and mental exhaustion. And it has largely 2 dimensions, and I'll come back to those in a minute, but it's preventable. It's pervasive. It stops us from doing what we want. And one of the reasons why I'm kind of highlighting this is for purely selfish reasons, because as I grow older, some of you are going to look after me in my dotage. So I just want to make sure that you're not burnt out and you're able to sort of look after and take care of us old fogies. What happens in burnout is that it's a response to situations that put pressure on us. It is about emotional exhaustion. It's about depersonalization, and it's about absent sense of any personal accomplishment. And particularly if you're combining clinical and research and policy and politics, it can push you. And I'll come back to the solutions just before I conclude. So there's a distinction between stress and burnout. Stress is about over-engagement. It's about overactive emotions, and it's about urgency and hyperactivity and a lot of anxiety, whereas burnout is more about disengagement, feeling helpless, feeling hopeless, feeling trapped, that you can't get out of the situation you are in, and more that you don't have a control over it. And I think control is incredibly important. One of the big challenges in definition of burnout really is, uh, sometimes people argue that, it's kind of one of those wishy-washy terms that nobody really understands. And if you don't like your job, you can pretend that you're burning out. But I think it's much, much more than that. There are lots of reasons for it. I mean, first and foremost is this lack of control. It's also about lack of ability to make decisions. So you're sort of stuck for whatever reason. You're trapped in a situation, in a work environment where You want to make certain decisions, but you cannot. Um, but it's also important to realize that quite often it's about monotony of work. Same old, day after day, week after week, month after month, year after year. And it's about chaotic working situations and chaotic working circumstances where people feel that they're trapped and they have no control. Part of it comes from the sense of perfectionism that all doctors have. We want to do our best. And when we want to do our best, and if you are not able to deliver that, you feel frustrated, you feel angry, you feel let down by the system, by people, and so on and so forth. So, what tends to happen is that you first step, you get the kind of stress arousal. And then that leads to a sense of maladaptive strategies, which can then lead to feeling exhausted, which may lead to anxiety, depression, suicidal ideation, and even suicide. And as a result of burnout, number of medical errors increases. We feel less professional. We feel more and more trapped, which leads to increased turnover of staff. If you are feeling burnt out and you're not answering your mobile phone or pager or phone calls, staff start ignoring you, they bypass you. You may feel angry, you take out your anger on people who don't really deserve it, and it can lead to depression and suicidality. And research has shown that the rates of burnout are very high in the first postgraduate year. So largely between first and fourth year, but more so in first year. And we can sort of have a debate about why that should be and what are the reasons, but it's worth recognizing. And one of the potential explanations has been this double bind that we get into, which is about um, on the one hand, we want doctors and students to be empathic. So we need to demonstrate empathy to our patients and their families and carers. And at another level, we are expected to be professional to keep our boundary. So you can't have it both ways. And I think that is part of the sort of expectation that mentors have. So a good mentor will sort of say, okay, let's kind of take a step back and see what we need to do. So it can lead to exhaustion, it can lead to disengagement. About 2 years ago, we did a survey of the doctors and medical students and their burnout in through the British Medical Association, which I was president of at that time. And we found that the rates of burnout among doctors were massively high. It's not a new phenomenon. And we then decided to do a cross um, nas- national survey of 12 countries, which showed interesting findings, which then led to 25 country survey, which is going on at the moment, which kind of COVID has contributed to the stress and so on and so forth. But in 2018-19, when we did the first wave of surveys, we included 2 private medical colleges and 2 government medical colleges in India. A total of nearly 600 medical students responded. So we gave them general health questionnaire 12. We gave them CAGE to measure their alcohol intake. We used Oldenburg questionnaire to measure emotional exhaustion and disengagement. And we looked at the various stressors. So in a nutshell, the findings were um, not surprising. 62% of the students scored positive on GHQ 12. 88% reported disengagement, 81% reported exhaustion, 8% had been drinking alcohol to get their anxiety down, which compared to the sample in the UK, where 1/3 of the doctors were using alcohol self-prescription um, to kind of keep their anxiety levels down. And 15% of students were using cannabis. And When we looked at the stressors, the lowest number in the 12 nations was that only 6% of Indian students complained of stress due to studies. But uh, again, 18% compared financial stress, which is again one of the lowest in those 12 countries. But interestingly, 69% complained of relationship problems, and most of it was to do with parental pressures, parental expectations, and which you can sort of identify that, parents are doctors and children are going into medicine and parents are running private hospitals. So there is a sense that, you would do the same specialty as the parents were doing rather than choose your own path and those kind of pressures. But surprisingly, 42% complained of housing pressures. So, what should you be doing? I think there are responsibilities both for um, organizations. So, each organization, each hospital, each university has a moral and ethical responsibility to look after students. Um, and as um, an individual, and again, organizations like IAPT or Asian Federation of Psychiatric Trainees or European Federation of Psychiatric Trainees comes into its own, which is about forming friendships, forming circles of support, peer support, which is also about recognizing ill health in colleagues who may be struggling, taking them to one side and saying, hang on, here is a problem, and how do we help you deal with it? So, in uh, what you should be doing as individuals is seek help when before it becomes a problem. Use support organizations, initiate memberships where appropriate, have very clear boundaries, make space for yourself, allow for colleagues, share problems with family, with friends, with colleagues. Admit your vulnerability if you're feeling stressed. You are human, just like your patients. Identify and prioritize your activities. Adopt a healthy, balanced lifestyle, good sleep, physical exercise, good diet, maintain good relationships and friendships, use peer support systems, take regular breaks, use emotional intelligence, and find a voice through professional bodies like, so know the sources of help. But in the medium to long term, I think there are two or three things that you need to bear in mind. And I always tell medical students, and I tell the same thing to trainees, that whatever you do, have fun. And if you are not having fun in whatever job you're doing, then change something. There is something wrong in the job that you're doing. Create a right mix of interests. So if your interests are in research and clinical activities, combine the two, do a bit of teaching, and if 5 years, 7 years, give up teaching, become an advocate, do that 3 or 4 years, give that up, get work in a voluntary organization. So change bits of your career, change bits of your portfolio so that your different parts of your brain keep um, active and fresh. So just to conclude, I think it's absolutely vital to look after oneself. It is important to seek confidential peer support if it's needed and if it's possible. There's no need to be ashamed if you're feeling stressed or anxious. You're human, like your patients. And if you can't look after yourself, how are you going to look after others? And this will make you a better doctor. So good luck. Thanks very much for inviting me, and thanks for joining. Thank you.